Why campaign against colorectal cancer? Imagine you could save one life by telling a story or by writing an article. Would you do that? Or by sending a tweet within the next 10 minutes? Imagine you could save 100 lives by making a program or writing a book. Would you do that? Why doesn't this happen more often? I'm Dr. Colemont. I'm a gastroenterologist. That's part of my blue team. And we're trying to saving patients from colon cancer. This is my problem. In my institution, we see too much colon cancer. At least 12 times a month, I have to tell to a patient that he or she has colon cancer. This is my biggest problem. In 2014, innocent people are dying because of a lack of information. We are living in an information society, and people are dying because of lack of information. That's how it looks like. Colon cancer is a silent killer. And if you don't know the enemy, you can't win the war. What do you know about colon cancer? These are no big data. These are just 5 simple numbers about colon cancer. 95, 5, 10, 50, 580. Colon cancer is 95% curable if early detected. That's a good news about colon cancer. The chance to have colon cancer is 1 out of 20. That means that 1 out of 20 people in this room will get colon cancer. The good news is that 19 out of 20, 95% of the people won't get colon cancer, but they have to know what to do. How many people know that 10% of the patients of colon cancer are young people? 30, 45, 41. The majority is over 50, but 10% of the people are young people. How many people know that 50% of the colon cases are detected in a late stage, stage 3, stage 4? These patients need chemotherapy, radiotherapy. This picture was taken 1 year ago, and I can tell you that today, 5 or 6 patients passed away because of colon cancer. What's this 580 meaning? How many people know that today, yesterday and tomorrow, 580 Europeans died of colon cancer? That's 2 big airplanes with colon cancer patients disappearing every day, yesterday, today, and tomorrow. News is what happens today, not what happens every day. It's not new that every day 500 people die of colon cancer. So that's nothing for the news bulletins. How many people know that March is the International Colon Cancer Awareness Month? The blue ribbon that I'm wearing is a symbol for the fight against colon cancer. How many people know that this man, who was yesterday in Paris, wrote this brilliant letter, Barack Obama, to the American people, getting and speaking about the Colon Cancer Awareness Month in March? How many people know this simple IFOP test? It's a very simple test. This you can use in your bathroom. You have to put it in your stool. It's no very sophisticated thing, but it can save your life. How many people know to use this? It's called a mascara test. You don't have to go to your eyebrows, but you have to put it in your stool in the bathroom. It can save your life. I think we have a problem. There's a lack of knowledge of colon cancer in the general population, by the general physicians, and also by the specialists. And I have to say also by the journalists and the politicians. This might be one of the problems. The colon is not the most attractive organ we have. But if you are positive, then you can say, wow, this is a nice organ, let's take care of it. I was fortunate that 4 years ago I met these 3 high school students. And they told me everything about social media. But we had only one problem within any budget. Our budget was 0.000 euro. But it was social media. And we started to use social media. As you all know, you can do 4 things with social media. You can share knowledge, you can discuss with people, you can network, you can publish. I published a lot of things, And that's what we did with our foundation, Stop Colon Cancer. We shared our knowledge, we discussed with people and patients, we networked, and we published quite a lot on several platforms. The three most important things about social media are quite simple. Is it content? Is it content? And it's a content. That are the three most important things about social media. And if you're on Twitter today and you send out your tweets, think on focus. It should be friendly, it should be original, it should be credible, it should be useful, and it should be serious when we are dealing with health and with patients. Screening and prevention, that's for the health authorities. Diagnosis and treatment, we as doctors will take care of it. But information and education, every one of us can do this. Education is the most powerful weapon you can choose to change the world. I really believe in this. And Bartolomescu, who probably is in the audience, I think he's one of the brightest medical futurists. I completely agree with him that medical professionals should also be able to prescribe information instead of drugs and pills to their patients. They should prescribe information to them. But you have to be careful. When you send out a tweet, when you write an article, when you do a test, within a few minutes, you can make from a happy citizen an anxious patient. So be careful when you write and tweet about health. That's what we are trying to do on our website, www.stopdiabetekanker.be. It's in Flemish. We are a small country, a part of a country, but I really believe that more information will lead to less colon cancer. And at present, our Facebook page has nearly 30,000 people on Facebook. And I'm putting every day messages on Facebook on colon cancer to inform the people about the problems they can have. And it works. This is a brilliant story. I won't go into detail. But this guy, Erik de Verme, 44 years old, he said, I'm still living thanks to the information on our website. He was discovered colon cancer stage 2 thanks to the information that he found on our website. Let's have a look to the numbers. You have breast cancer on the left, you have AIDS, you have the PIP implants, probably some PIP implants in the room, and you have the traffic victims. My own father died in an air crash in Kenya 20 years ago, so I know very well what it means to lose somebody in a traffic accident. But let's have a look to the numbers of colon cancer. Imagine that the media would pay the same attention to breast cancer, to colon cancer, as they do to breast cancer, to AIDS, and to traffic victims. That would change the world. That would save lives. It's no big data. These are real data. Stop Colon Cancer is an action group. We are no working group. I'm in several working groups, but I like more the action groups. We really like action. It's time for action. And we did many actions. We did a Save Your Selfie campaign. This is a minister-president from Flanders, Chris Peters, who supported our campaign. I made a school board giving some information on colon cancer. We did hip-hop dancing with young people. We went to a soccer game, and we have now our own giant colon. We need action to fight against colon cancer. When Brad Pitt turned 50 on 18 December last year, we had an idea. I sent him a letter, and we put this on social media. And we didn't only send him a letter, but we sent him a real letter with a real test, and we asked him to do this test. That was news. These 580 people, that's no news. But when a Flemish doctor sent a letter to Brad Pitt, that was immediately on all the websites and all the newspapers. We were on prime time on television, radio was following us, and there was a lot of buzz on the normal media too. There was national impact, but there was no reaction from Brad Pitt. So we combined this with a Thunderclap. I don't know how many people know this Thunderclap, but it's a brilliant platform. It's a crowd-speaking tool that you can use to send out your message on the same day by many people, the same message on exactly the same moment, and this will give you a Thunderclap. And we did this Thunderclap. We found 314 supporters to support our action, many politicians, many celebrities, but also patients, unknown people who supported our action. And on 7th of January, we reached out this message, we sent out this message, and we reached 1,250,000 people with 1 letter, budget, 0 social media. And it was picked up in the States by Adweek, it's a big agency, and they said, well, look at this, colon cancer group raises 340% of a goal with a public letter to Brad Pitt. And this was tweeted more than 200 times. So it went all over the world, and we had this nice viral effect. I received this one. I couldn't read it, since it was from Macedonia, Skopje. They called me for an interview about our action. And that's the world chart of our action. We reached with 1 letter, with a budget of 0, using social media, more than 5 million people worldwide. Can social media stop colon cancer? I don't know it. What I know, that the biggest risk of social media in healthcare is not using it at all. You have to use it. We must stop colon cancer. My dream is to live in a world without colon cancer. The dream can be simple, but the reality can be very difficult. Sometimes I have the impression that I'm in the beginning of the road. Sometimes I'm thinking that I'm nearly in the end of the road. But I will fight as long as my cloud score is higher than my age. There is something we can do. We can act now. We can write about it, we can share, we can teach, we can speak, and we can tweet and retweet about colon cancer. I really believe that by sharing knowledge, you can save lives. I thank you for your attention.